Over to you, Ian.
Okay, thanks for joining us this week. I think topics this week is disability and COVID. If people just want to put their groups and their name in the chat, I'll circulate the chat afterwards. And also, if you want to put your contact details in the chat, I can, like I say, I can circulate that to people. So I think the first speaker is Samantha.
Hello, everyone. I'm from the Volunteer Centre and I'm hijacking your meeting for 5 minutes. I've been allowed. So I'm going to be brief and I've got some slides. And I need to share my screen. Can you see that?
You can.
Marvellous. Right, so you may not know this, but every year Volunteers Week is from the 1st to the 7th of June. So I just wanted to share some information about what we're going to be doing and some last minute ideas for what you could do with your volunteers. So obviously during the pandemic, I think so many people wouldn't have got through it if they hadn't had volunteers able to support them. And it's been such a challenging year for everyone. So we just wanted to ensure that we were able to thank people who volunteer for all the groups that we support. And we wanted to say a big thank you to all your volunteers. I know that some of you yourselves will be volunteers. So thank you for everything that you've done. And again, one of the things that people have researched into is whether volunteering has a positive effect on your well-being. And yes, it shows that volunteering can have a positive effect on your mental health. I know myself, I was unemployed for quite a period once, and I was getting quite depressed, and I started volunteering. It really did have a positive benefit to me. So if you've got clients or service users that you think could benefit from volunteering, please do point them towards our website where they can find out more about how they can volunteer for their own well-being. I'm sure you have planned ahead and have ways that you're thinking of thanking your volunteers and perhaps even involving new recruits during the week. If you're still looking for inspiration, have a look at the Volunteers Week website, and there's the URL for that. And Ian's going to send all the slides around afterwards. And if you need help promoting opportunities in either Ealing or Hounslow, in Ealing, get in touch with me, and in Hounslow, get in touch with my colleague Parul, who I don't think has been able to join us this morning, but I know you'll know her from our other meetings. And next week, check out our website, and there's the URL for that, and we'll be highlighting on there the themes of Volunteers Week. And if you'd just like to know what those themes are, hopefully you can see that too, because has that slide changed for you to the themes?
No.
No.
It's got your
Don't know.
information on it, like
I don't know how.
Sorry.
Oh, hang on. I'm going to stop sharing and share again and see if that makes a difference. Oh, there it is. Can you see something that says themes for this week at the top?
Yeah.
Marvellous, right. So the themes for Volunteers Week are going to be on the Tuesday, which is the 1st. They're branding the whole week as a time to say thank you, really. So the Tuesday the 1st is the kickoff for that. And then the 2nd is going to be the power of youth, which is about how young people can get involved in volunteering and the difference they've made as well during the pandemic. The Thursday is about employer supported and skilled volunteering. Now the 4th, we're going to brand it ours amongst that as volunteer voices and experiences from volunteers who've been involved in the communities. On Saturday the 5th, it's Environment and Conservation Day, and it also coincides with World Environment Day. And we've got various activities across the 2 boroughs that people can drop into during the week. and they are going to be on our website in that calendar I was telling you about. And on Sunday is the big lunch, and we're thanking all the organisations that made sure people still got fed during the pandemic. And then on the 7th, it's again a time to say thank you. And on various social media platforms, we're going to be asking volunteers to share their photos of themselves and their friends and family volunteering, so that we can all see what each other has been up to. So that's what we're going to be doing during Volunteers Week. Now, with any luck, has that changed back to a PowerPoint slide? What you can see? No? Yes?
No, it's the same as Teams still.
It's the same. Okay, right. All this, that was the last thing I wanted to share, was the Volunteers Week media pack. Ian's going to be sending that round as well. So I'm going to stop sharing. Did anyone have any questions about Volunteers Week or volunteering that they would quickly like to ask before I stop hijacking Ian and Yoko's meeting?
Will we be able to get a pack of that information, Samantha?
Yeah, Ian's going to send around the PowerPoint slides, and it's got the link in that to the Volunteers Week website, but also Ian's sending around the media pack, which has got that branding for it's got all the logos that you can use, and it's also got what the themes for the days are in that pack. So I think that was the easiest way to communicate all that to you.
Just to let you know that our Rotary International within these islands, we're also celebrating Volunteer Week because we're all volunteers. In fact, today I was supposed to be on a face-to-face with Ross Kemp, but because Hounslow went into that confusing situation of whether we're in lockdown or guidance or advice, I took the precautionary measure of not being able to meet Ross Kemp because we were going to do something to celebrate Volunteers Week.
Oh, that's a shame.
Yeah, so there was going to be people from the Women's Institute, the Royal Volunteer Group, Rotary, and I was representing Rotary, but unfortunately, because of the uncertainty around what Hounslow was doing, I took a precautionary measure and decided not to go to the thing because no one could really tell me whether we should leave Hounslow or not, etc. So that's my that's my loss.
The news has been a little unclear in its guidance, hasn't it?
Yeah.
Right.
So that's why.
I will. That sounds great that you're all doing that, though, and it's really. I think it's important that people say thank you to their volunteers. One of the primary reasons that people stop volunteering is that they turn around and they say, "Well, no one ever thanked me." So it is good to say thank you. Right. I will leave you back with my colleagues. I will stop hijacking your meeting. Thank you for listening to me, and Ian and Yoko will circulate the information that I've spoken about. So have a good meeting, everyone. Bye.
Okay, thanks, Samantha.
Thank you.
I'm not sure, is Sterling on the call? Sterling Rippey?
Sterling Rippey. Maybe she might just join us a little later, but she was supposed to come and give us some messaging on, the new rules in Hounslow, and also the spike in cases, and also the vaccination drive that they have, they've increased that. So hopefully she should be able to join us, but she wanted to be a part of the session.
Yeah, I've been sharing as a community champion. I've been getting all the.
Would you like to share something with us, Mukesh, then? If you have any updated information.
Okay. Yeah. All I can say in terms of the information I got over the past 48 hours is firstly the information about us being in lockdown. That was, I wouldn't say withdrawn. I think they changed the weasel words to say we're now, it's purely advice. But that, as all that's done is actually create more confusion. But the message from both Steve Curran, who's the Director of Health for the London Borough of Hounslow has been focused on saying Hounslow is open. All that they ask us to do is to be cautious, try not to go into crowds, continue with the social distancing. The other thing they wanted to mention to people, especially in certain areas, was that members of people from either the NHS or volunteers or London Borough of Hounslow were actually visiting particular surge areas and giving test kits. So if it happened yesterday, we had our kit arrived and they asked us how many people in the house, and they gave us the equivalent number of kits. We then meant to scan. And the funny thing is, I told him, I said, not everyone will be able to scan. So we just have to remind them that they think that everybody's able-bodied, and we're not. He said, I'm awfully sorry about that. Once we've done that, we then have to drop it off at Hounslow House. Again, a little bit of a problem for many people who aren't able-bodied. So a little bit of a shame there. I don't think they've actually thought that through. I know that Celia's on the call, and I think Celia will probably saying on behalf of people who have disabilities, perhaps they should have actually said, you know, if you have a difficulty, we can come back and collect it. Because people are, you know, the folks who are volunteering to drop these things off, you know, they could come back. And I don't think that's a major exercise to come back to the few people who have disabilities, you know, in comparison to the 450,000 residents of the London Borough of Hounslow. The other bit of news was that they brought in more locations where you can actually go and do not the PCR test, but the lateral, what do they call it? The lateral test, which is within 30 minutes.
Lateral flow test.
And I went lateral flow testing. So I happened to be at Bedfont Lakes. I'd gone to get some fresh air, and there was one of the vans there. I went along, and literally within 5 minutes they had done, they got me to do the test in their van. I stepped out. By the time I'd come back to my car, that was within 30 minutes, I'd got a text telling me I was negative. Albeit was sticking this thing up my nose, and other than that, it was fine. What they're also doing is that they're going to religious centers or faith centers, and they are doing not only the testing, but they're also doing the vaccinations. So we've been, you know, people like myself have been saying this for God knows how long, that if you're having issues with certain faith groups not coming forward to have their vaccination, why don't you just go to their venues instead? A lot of them have large car parks, and social distancing is possible. So for the Islamic community, what they've done is at the Wellington, the mosque on the Wellington Road, they've actually got a mobile vaccination center. That's there's a significant number of people who will be walking to the mosque, and they are hoping, like they have, of having more people either having their first vaccination or their second vaccination. And since the government have reduced the age down to, I think it's 30 now, I think it was 34, more people are able to get their vaccinations. So it's a larger population. But in London, don't forget, the other message was that London as a whole has the lowest uptake of vaccinations. And that's one of the reasons why there are a significant number of boroughs which are having problems. So for example, Hounslow is in the top league, With Ealing, we both last week had 147 cases, but Hounslow, on the other hand, has got worse. Ealing, Harrow, Brent impacted by this surge, but also Redbridge and Croydon. Because of my connections and my social networks within Rotary, some of my colleagues are based in Farnborough and in Fleet, which is the borough of Rushmore out in Hampshire, and they've even got surge positions there as well. So massive amounts of NHS resources are going in, not just in London, but in the home counties as well. So that's a significant. You know, I hope that's helped to that. The London Borough of Hounslow has has had support from the NHS in terms of both vaccination, in terms of testing. There is a lot of information on the London Borough of Hounslow website, and what I've been doing is taking the messages which I'm being sent as a community champion to make sure I share that on my WhatsApp groups, because I've got a number of different WhatsApp groups which do different things, and they are getting those updates, and I'm asking them to then network that to other friends as well. Sterling is online, so I'm hoping I haven't stolen her thunder.
So sorry, I'm struggling to connect to the Hounslow House Wi-Fi today. So finally,
okay.
I've been able to connect on my phone.
I've been telling your story about what, as a community champion, the information I've been getting and how I've been sharing and talking about the mobile vaccination centres, the mobile testing, both for lateral flow and for PCR. I've also mentioned about that there are people who are coming round and dropping off the testing kits. They're leafleting on one day, and then dropping off the packs the second day. But I did say that there is a bit of a fly in the ointment, and I said that Celia was online, and one of the things which I felt uncomfortable about is that they haven't actually thought through carefully about people who have disabilities, because when I asked the individual, I said, well, who's going to come and collect it? Because I don't want to be in a crowd. And they said, well, you have to go and take it to Hounslow House. And I said, yeah, but I don't want to be near lots of people. Can you not just come back and collect it? And the answer was no. The answer was no, an emphatic no. And I felt that was very inappropriate for someone who, like myself, has a disability. That's it. That's all I wanted to say. I'm just giving you an update on what I've shared about bed vodka and various other things. Yeah.
Perfect.
Thank you, Mukesh. I'm sorry I just pushed the spotlight on you, but thank you for that.
Okay. As I said, I'm a community champion, and like many of us on this chat, we all get the information, and the whole idea of the community champion came about. I'm part of the Hounslow Friends of Faith, and we had Kelly come on, and we were saying you need to engage with organizations like Hounslow Friends of Faith, because we're representing a broad section of the community, and we can then disseminate information. But then why don't you create the similar sort of thing, but with Joe Public? And I'm sure with the theme around volunteering, it's been really important that we get these community champions to share and then get people to go and do what they're supposed to do, i.e. get the vaccination, get the testing, etc. So I don't mind. I'm happy. I think we've lost Sterling again. No, she's there in the corner, but she's lost her.
Oh, can you hear me now?
I can hear you, Sterling. I'm
sorry
going to
about
stop
that.
talking now. I've talked enough. Is that enough information?
Let her speak when she's got the chance to be connected.
Yeah, is that enough?
Do you mind if I just share a few things quickly and then?
Yeah, go ahead, Sterling.
Yeah, perfect. It's just, I think you've shared quite a lot. So I'll just share a few tools that you might be able to utilize to share. I think you've covered kind of the details of the overall program. So as has been shared, the infection rate in Hounslow is higher, and there's concern about the new variant. And so we're taking quite a few actions, and we're in quite a good place to take good actions going forward in the next 5 weeks to test as many people as possible and also offer the vaccine to as many people as possible. So as a public health team, we see this as quite a good opportunity to get as many people vaccinated, which we're leaning on that opportunity of extra vaccines, extra resources to try and speed up the vaccination rate here. So I have a slide deck that I'll share in an email out that just is a quick overview of the program that you can utilize with your organizations or with your community groups that you can share. And it just covers the kind of reasons why we're doing this, the purpose of what we're doing, how we're doing it. So we're adding extra testing offers, we're doing door-to-door knocking, slowly moving through the borough. We've had some feedback that people saw that people were on the street and they didn't get their tests, but that's probably just a sign. If you hear that, it's probably a sign that they ran out of tests and they've had to go back to Hounslow House, and they will come back. So they do work up until 5:30 on each day. If they miss you, they'll come back the next day. But if they aren't able to reach all the streets that they leafleted the day before, they will go back the next day. And if not, just give us a call and we can arrange. They are collecting the test following. So I take the feedback that you weren't giving a test back. They are following that street about half an hour later to collect the test. So they should be available to someone who wants to take the test at home and not leave their home. It should be available. That option should be available. So I'll just double check with the team that that's still the case and feed that back. That some people aren't experiencing the follow-up where you can give the test back. But the main message we really want to get out today, and I think the hardest message to get out, is the purpose of getting a test post-vaccine. So a test, most people who are not saying yes to a test because they've said that they've been vaccinated. And the point we really need to get across is that everyone needs to get a PCR test. Everyone, no matter first dose, second dose. The reason for that is because even with a vaccine, there is still a risk that you could spread the virus to someone who is unvaccinated or has only had one vaccine or just received their vaccine. And you're less likely to know that you're doing it because with the vaccine, you're more likely to not experience symptoms. And so we still need, whilst we're working to vaccinate everyone in the borough, and we're doing all we can to do that, there is a group of people who have yet to be vaccinated and they don't yet have the opportunity to be vaccinated. And so whilst we work on getting the vaccine, we still need everyone in the borough to have a PCR and just have one PCR test, and then continue testing rapid tests that are available online or through home collect or through some of our rapid testing sites, which are now doing PCR and rapid testing. So we want people to please all get a test, no matter how many vaccines you've had or how long ago your vaccine was. So if you can help get that message out and help to explain to people the reason why, we'd really, really appreciate it, because I think that's our biggest hurdle at the moment is people are happy to get the vaccine. The vaccine is kind of the sexy story of go get your vaccine, let's be protected. The testing bit is less attractive to people, but it's really important. It's how we know that a PCR test lets us know, is the variant spreading really quickly? What can we do about it? Where is it? So that we can do more targeted efforts to stop the spread. So that's a really important part of the next kind of 5 weeks. So I don't want to take too much time because I know I was supposed to be done at 10:50, but I will share the slides, which has the resources. hounslow.gov.uk/surge has all the information you need updated every day on the hour as things change. hounslow.gov.uk/drop-in clinics has all the vaccination clinics for the following week. So I'll just pop all of that with the slides into an email that you all have it. And if you don't mind sharing with your networks, would really appreciate it. And thanks for everyone who's already done stuff for us with getting volunteers. And it's been about another mad week in the public health team.
Okay, thanks, Sterling. Anybody got any questions for Sterling? I'll circulate these slides Sterling's talking about to everybody. So, Lisa?
We'll add it on
Sorry,
the
do you mind?
website.
I can't quite get my head around it. So say if someone drops in the test. So someone came to my door about a month ago and said, offering the test. And I said, how do they said, we can collect it again 20 minutes after. I said, okay. How do they know that it's me doing the test? And they couldn't answer me. So, because when I tried to log on and register the test, it wouldn't recognize the number on the box. So I thought, what's the point of doing the test if they don't know it's me and can't trace it back? So, or have I missed something completely?
So we've produced a new leaflet that goes with the test that talks about how you register them, because the online program from DHSC is designed for someone who orders a home test through Royal Mail, and it's connected to the Royal Mail order. Because we're doing a home delivery on our own without the help of Royal Mail, we have to skip that step. So there's a new leaflet that comes with every PCR test through the door that has a QR code and the link to the exact web page where you can register and put your name in. And it's really important that people do that, because as you said, how will you know? How will you know if you're positive or negative? And how do we know? How do we know where it is? So it's really important. If you do have issues with logging it, 119 will help you handle that. And if they say they can't do something, then we'll get you another test, because it might just be an issue with that barcode. So 119 is the best person to call if you have any issues with registering, with receiving your results, those types of questions. And then the hub and the support team in Hounslow can help with kind of logistics of when will people be coming. So those types of things. But yeah, so it is really important, obviously, to get your name attached to that test.
Okay, that's fine. So now you get a leaflet with it. That's fine. Thank you.
Yeah. And it also talks about what to do once you test positive and the support available if you were to test positive. So we're hoping it kind of covers that whole journey of take a test, hopefully you're negative, but if you are positive, here's the things that are available to you.
Yep.
Mukesh?
Yeah, my question goes back to you, Sterling. It's for people with disabilities, both whether they're visible or invisible. So for example, someone who is hard of hearing or is partially blind, many of those individuals won't necessarily have smartphones, so they can't use the QR code. I know you just said ring 119, but I think there is a genuine need for LBH to, as a former counsellor, I always used to say, it's great that you're doing all of this work, but you're not being equitable to a significant group of people. And there are about, I think, 20 to 30,000 people who have some form of disability in Hounslow, and they seem to be forgotten. And
I think it's really more even.
That, you know, whether, well, the population of Hounslow is 450,000, 250,000 voting people, but 450,000 people. But it's the people who are, you know, either they are forgotten. They really are forgotten, and I don't see any information on the website explaining how, if you're a carer, how you can support someone who has a disability in this process. So if you want to take something back to Kelly, I think it's really important that we support, because we've got a section later on.
I think so too.
Asked, what have I done?
I think so too, and we got some feedback about that yesterday. So I've asked for that to be added to the websites and support. And some of the trickier issues, we've asked the GPs to come and support testing out where someone is unable to do it individually or something like that, or they're unable to get to a testing site or something like that. So I will make sure, I did ask for it to be up there, but I don't think it is up yet. So I will make sure that there's some guidance for carers.
I did ring a number of GPs just as a test, and all of the GPs are basically the ones I rang, and there was about 3 or 4 of them, different clinics, and I just said, can I have a disability, can I come in to have a PCR test as recommended? And the answer was, we're not doing PCR tests, we're not doing lateral flow, and we're not doing vaccinations. You have to sort that out yourself, which was totally unhelpful for someone who has a disability or is unable to move. So it's not meant to be criticism, but it's meant to be critical feedback.
But it's something I need to take back. So definitely.
Yeah, and the CC, I don't know what the local clinical group is doing about this, but I know that Kelly doesn't necessarily have responsibility for them, but she has a significant sway in convincing them to actually do something about it. So please accept my apologies that I'm pointing to you, but I'm also representing a significant group of people.
Exactly. Definitely. So I will feed that back and hopefully find some solution quick.
I also volunteer with the Deaf and Hard of Hearing Women's Group and was trying to get a vaccine booked for a deaf friend who hasn't received the text. She's got no speaking or hearing or reading or writing, and the whole message, which I was able to understand, but it's very complex as well. So it's very difficult. I just want to support people who are maybe on the fringe. I'm in Ealing Borough, but the same. You're doing a great job, but it is very hard to reach more difficult to reach groups. And I'm challenged there because somebody said recently, you shouldn't call them difficult to reach, just that we haven't succeeded in reaching yet.
Exactly. If you saw Kelly on the BBC this morning, she said exactly that. It was not the hard to reach, it was the hardly reached. So she's got an agent and is now a celebrity, if you haven't seen the news lately.
Okay, thanks to...
I used to speak to Kelly near enough every week, and I know Roger speaks to her every day. So but this particular group you're talking to, there are a number of people who do express our concerns, and Kelly is very good at taking some of those on board, and I think we appreciate everything and the team, including yourself, are doing.
Roger?
Yeah, I just wanted to add to what Mukesh has been saying, really, and that, a lot of my members now just don't want to go out. So they aren't. What can we do? Mind, it's good that they don't go out because there's less chance of them getting the Indian variant anyway, but, it is a problem.
Are they not wanting to go out for a test? Is that what you're saying? Sorry.
They don't want to go out at all.
Oh.
They're in self-imposed lockdown.
Yeah, and I think that the news this week wasn't helpful either. So I think that's been another hurdle to face. Each day feels like a week this week. I think there's a lot of work on just getting people out and about and feeling safe out and about as we move forward. So hopefully we get there, and hopefully this response of getting more people vaccinated helps people to feel more comfortable going out in the future.
Yeah, I had my hand up, Ian. Just to let you know, I double mask still, and I'm in the shielding and vulnerable group if I do go out. So I put my blue one on first, and then I put my cotton one on top. And I avoid all crowds. I do order everything online, but this week has been one of those terrible weeks where I've really, like Roger and lots of people I know, we are absolutely at a loss as to should we or shouldn't we. It sounds a bit like Boris, do this, but don't do that, and do this and perhaps do that. It's very, there's no clear-cut message. And as we were mentioned in Parliament, the borough, plus the fact that we were being put into the same category as Bolton, most of us were really quite concerned. And I know that many people just did not go to the shops that following day, or didn't do anything. They just pulled the shutters down and said, okay, we've been at home for 15 months, right? We'll just be at home for another couple of months. I'm not really worried. I'd rather be at home. I've had my 2 vaccinations. I'll wait till September to get my booster if necessary. But I'm very mindful that we've done everything, and there are so many people like members on this group who've actually have taken that stance that we're not going to go out until the last member of our organisation has had theirs, and then we're waiting a month so that the vaccines actually take effect. So if someone has an vaccination in July, the first time I'm going to want to meet that person is not until August in a face-to-face conversation. It's that serious.
Okay, I'm just aware that we're slipping from the agenda timing, so if, make sure nobody's got any last comments. Like I said, I'll circulate Sterling's slides after the session. So thanks, Sterling. And now
Thank you all.
Celia.
Yes, hi. I'm just conscious that I get kicked out with my camera, so I'm just going to present myself for 2 seconds and then try. That's me. Hi, everybody who doesn't know me. And then, right. Okay, I'm going to trot through. I'm conscious of time, and I've been given 2 big briefs to talk about, which I'm not in a position to give it justice in the time that has been allocated to me. One is the impact of COVID on disabled people and the impact of COVID on BAME communities. Sorry, I should be expressing that in full, which is Black, Asian and minority ethnic communities. So I'm going to talk about some of the strategic issues because you've already identified some of the operational issues as you from the last session. So basically, I apologize if some of you already know this data set. Disabled people, those with limited or little or limited a lot in terms of their day-to-day activities, made up about 6 in 10 of all deaths involved in COVID-19 for the period to March to July 2020. So effectively, in terms of numbers, it was 27,534 disabled people passed away in comparison to, against a total number of 46,314. So obviously, quite a staggering number of people with disabilities. And the reason why I start with that is because, when you looked at who would prioritize, it was an age cohort basis. The Joint Committee for Vaccination gave an age cohort as the basis for priority for vaccination. And yet, if you then looked at the numbers, it kind of gave you a very stark reality that a lot of disabled people were at the forefront of being affected by the COVID-19. A key thing that Public Health England published in November 2020 was that people with learning disabilities were 6 times more likely to pass from COVID than the general population. And they also noted that individuals with LD under the age of 35 were under the age of 30, I think, were also more likely to die from the virus than their peers. So there was sufficient evidence about disability for the government to have actually looked at a different kind of prioritization in terms of who got access to vaccines. There is a legal challenge at the moment going on around this, and although many people with disabilities may have already got their vaccinations, the principle for future health-related issues across country does raise a question about what level of reasonable adjustments were considered by the government in deciding who was and wasn't a priority. So those things are being thrashed out legally, and it's just, and I think what the people challenging the government is looking to find is what should the principle have been. How should science have informed it, and what should the principles have been in terms of, how they decided the priority grouping? So that's a kind of, just a quick backdrop of impact of COVID-19. And I wanted to kind of just talk about a little bit about the fact that, a key part of the failure to think was that the Health Foundation explored the effects of the pandemic and felt they came out with the conclusion, along with the Public Health England work and a number of other research, that the effects of the pandemic was felt more acutely by disabled people, both because of digital inclusion, but not just on health grounds, but also digital inclusion, access to support and care at home. There were some 12,000 signatories and a lot of charities who challenged much of the way the government's policy direction was on this, including the policy direction on do not resuscitate. So really what I wanted to talk to you about then is that there is for us as charities the need to actually look at the way that the underlying health conditions was really the prominent message from the government, was that you're at risk if you have an underlying health condition, but actually they failed to make any reference to disability. So for people where, for the rest of the public, it was just about, well, if you've got an underlying health condition, you're at greater risk. But what did that actually mean? How was that message received for people, disabled people? And essentially, there was quite a lot of anxiety for those who had disabilities about the relationship between health, this underlying condition statement. So on the one hand, there was this kind of dumbing down of the relationship between underlying health condition and disability. And we heard already that people with learning disabilities were, kind of that much more likely to be affected by COVID than many of the other group cohort. So there were a number of issues that are being challenged by the charity sector, who represent people, the interests of people with disabilities. So just kind of quick trot then, because I'm conscious I've got to do the BAME one as well. That what happened during the pandemic and what was, clearly emerged was that there was a reduced access to health services for everybody, but this had and reduced access to support at home for those people with disabilities who had some sort of support at home. Those folks, actually had little or no provision about what would the alternative look like. And there was a sense that people were abandoned with their carers, for their carers to sort it out. And of course, Mukesh's point that there was very little clarity about, for carers about how do they manage that. And we know that also about the care homes and how that was managed. So quite a number of studies also highlighted that social care support reduced and that care plans itself were unsatisfactory. Because if there's social distancing and you can't go out, care plans didn't really have alternative solutions and interventions to support people with disabilities, staying where they were. I think though, so there's a big task of work to be done about what does that look like in an alternative care plan in this kind of scenario. So we know that many ordinary opportunities that make up life were suspended for all of us, but it's also felt far more sharply if you were disabled persons. But also things like disabled children and their families have been affected by a lack of access to education and schooling. It's compounded for them, and also there was an assumption about digital access and digital device access, digital connectivity, and all of those kinds of things is really kind of reinforce their equity in terms of access to education. So they kind of lagged behind dramatically more so than all the concerns we had with other children without disabilities. So inaccessible remote learning materials was added to even whatever was on offer, that it was even more remote and inaccessible if you had a child with a disability doing remote learning. And then added to that, there was this kind of the implications of not having the usual structured educational environment also had implications for disabled children's social and emotional development. And a number of other, the Women's and Equality Committee, the government said that, there was just basically a lack of effective support for children with special educational needs during the public health crisis. And it was a real challenge for most local authorities they were unable to rise to that challenge. Access to food was also compromised. Some disabled people with supermarkets, when supermarkets prioritize clinically extremely vulnerable, but that didn't necessarily mean that if you had a disability, you would, had a priority. So basically, the supermarkets had an approach which responded to the government's call to clinically extremely vulnerable. And so there were no adjustments being made, even though there was a legal duty to make adjustments. There were no adjustments being made for people with disability more generally. So we know that blind people refused online slots, even though they found it impossible to navigate the shopping in person without getting too close to other shoppers or breaching the distancing rules. So there was this kind of, what can I say? What's emerging from all of this pandemic is the fact that we went back to the medical model of categorizing, and we really, it replaced the legal requirements. And the commitment to make reasonable adjustments kind of went out the window. On a number of fronts. And even with shopping, you'd had to have a threshold of shopping to, you would have had to spend 40 or whatever pounds it was to even get yourself onto that listing, onto that supermarket listing. So a considerable difficulty. And then you have the other issue of mental health. There were a lot of disabled people living alone, which added to the anxiety and mental health needs. And it just more frightening because there was no one there to talk to them, no one there to provide the kind of support. Our charity sector, I think, stepped up more to the plate for particularly people with hearing challenges, but also our visually impaired residents as well. So I just wanted to kind of say that, well, what are we doing about it? First of all, let me just say that, I was in touch with our our organisations that support deaf residents, organisations that support blind residents, etc., to look at, what are the key challenges facing them. So at the moment, we've commissioned a piece of work from our Deaf Club and Hestia to talk to our communities, to our deaf residents, to then come back with the survey results on what were the key challenges, what do we need to change going forward in terms of that. The council has launched a British Sign Language service for deaf residents. During the start of the pandemic, we made sure that was set up. And then it was a question of trying to get the message out to our deaf residents in the borough to make sure that they knew that such a service was available. And our first contact point, anybody ringing the food hub, all of those people were alerted to the fact that we had this service. But it's still an ongoing thing about trying to get the message out. We do need to do more. So all I can say to you at this point around disability, before I move on to BAME, is the fact that we've set up a disability recovery partnership. And those of you on this group, you are welcome to come along or be part of it. We meet 4 times a year. It consists of all the groups. I think Roger's on it. It consists of all the groups in the borough who, we've only had our first meeting with identifying terms of reference, etc. And the purpose of that is to provide support for recovery and to, kind of gather what we've understood, the intelligence that we need to then make sure that going forward, we've learned lessons from it. The next meeting is in July, and we're looking at an action plan to come from it. And from that action plan on health, on employment, on social care, education, etc., all the things I just mentioned, there will be a lens on each of those things with different people leading the different things. What I wasn't being able to talk about much about is also older people's issues in terms of social isolation, etc., and the data sets that's highlighted where they are, etc. And we're working with Age UK for that. So I'm going to just park that to say that we've got a recovery consortium set up, and we're beginning to work with different groups in the borough to look at the taking forward the responses to that. The other thing I can see from Janine, she's interested in sign language service to deaf. Yes, happy Janine. If I will put my details in the system and you can contact us. Finally on BAME, again, I don't know, Ian, how much time have I got?
Yeah, I think you've still got plenty of time, yeah.
Okay, fine, thank you. So just moving on from disability, I just want to take quickly through impact of COVID on Black and Asian minority ethnic. The council took forward basically an equality impact assessment on what since George Floyd's death, murder, as well as the COVID impact and the ONS report, public health report from the governments, etc. I think somebody's got some sort of background noise going there.
Ian, can you mute everybody? Except C.
Yeah, just a little bit difficult to kind of have that
maybe,
noise.
is it not coming from your, oh, hang on.
Right, that's great, thank you. Okay, so what we did was to look at a number of things. We looked at sectors. We looked at the impact of people working in different sectors. Again, I'm going through this at fast pace. We found that people from, if you could forgive me because I'm going to say BAME because I know that's not that's a definition, an acronym that's being challenged hugely everywhere. But at the same time, I'm just going to for speed purposes of speed, I'm going to say BAME. Passenger transport, distribution services, deliveries, hotels, restaurants, retail, Heathrow Airport, domestic and personal services. These are the sectors which are dominated by Black and Asian minority ethnic communities, and these are also the sectors that are most severely affected by the lockdown measures. We looked at analysis of that and the number of people furloughed and the number of people unemployed in Hounslow. As a result of that, the figures, unfortunately, are March to May, which is why I'm not presenting it, because obviously those have been amplified and much far greater than what the actual figures are. Between March and May of last year, we were looking at about, just in that 3-month period, 15,140 people unemployed across 8% of the working age population. And the proportion of people claiming unemployment in Hounslow is 2% above the national average. And again, that was the first 3 months picture. And we also know that the areas with the highest rising unemployment were Heston, Cranford, Bedfont, Hanworth, Brentford, Hounslow Heath. And also the largest increase since the lockdown also were in West, Hounslow West, Heston West and Cranford. So really effectively what we're talking about is areas where there's a high level of BAME communities. We couldn't break it down, each ethnicity as if you kind of looked at ethnicity, deprivation and unemployment, you didn't get that breakdown. So we used a proxy measure, and the proxy measure is wards with the highest communities. We were then able to look at where have we had the highest impact. So we know that people from Asian ethnic groups are more likely to be working at risk economic sectors. Some 49% of BAME are employed in these sectors from the borough. Over 3,000 people in Hounslow Central are unemployed or in sectors subject to furlough, which means that Hounslow Central and further 4 wards had about 2,500 working age people working in these sectors. So what we're anticipating is those 4 wards plus Hounslow Central are going to be the highest hit in terms of unemployment because as the furloughing ends. Then we kind of identified that 3 wards in Hounslow where more than 1 in 10 working age population are unemployed, which is Heston West, Hounslow Heath and Hanworth. So we've got a pretty good picture of where is the highest impact around unemployment. We have actual numbers, we have the claimant count, we have the percentage of the working age population, which is quite high. You know, Heston West, we're looking at 57% increase in claimant count between March and May, which is the highest. Along with Cranford, again, 57% of working age population. So, you know, we've got some dire figures in terms of the borough community. That we also looked at things like digital connectivity, deprivation, and that all mirror exactly the same thing is unemployment. Literally, Hanworth, Feltham, and the BAME High wards with the BAME, you know, majority BAME communities, on a number of socioeconomic variables, whether it's civic assets, whether it's third sector organisations, whether it's digital empowerment, whether it is what was I going to say? Whether it is I was thinking about unemployment, deprivation. I think we looked at civic assets. We looked at number of other things, number of other variables, all of which point to cumulative impact on the same wards. So what are we doing about it? I mean, we've set up a digital inclusion group as a council. We are going to look at where are the broadband failures in the council. So broadband, we know that Cranford, Heston, there's poor broadband, which means that, you know, literally people can't even get onto the internet and there's no connectivity. So we've broken that down further and looked at the wards that need improved connectivity, and the council is looking to work with providers. It's already commissioned providers to improve broadband connectivity. We've got two other big strands by way of solutions for the digital inclusion work. We've identified skills and training needs, and we've looked at a third strand, which is devices. So those are the things we're looking at. We've set a special group up to focus in on that, and I'm in that group. We're also wanting to touch base on civic assets, which there's a major review going on around civic assets in the council about what assets are on each ward. And how can we continue to make sure that all our policy and our programs and our project have an eye on the fact that I've highlighted all these inequalities across the borough. So really just wanted to, that was a quick trot through what members are being briefed on. I'm meeting members every week. We have a separate inequalities task group with members, cabinet members, as well as backbenchers who are all working with me, looking at ward-based inequality, and then looking at working with members to provide them support on interventions. What is and isn't a proper intervention for the inequality they've identified? Who's doing that? And what kind of support is and isn't available? What's the gap analysis between what we're doing and is it really meeting, is it really responding to the inequality? So that is a piece of work going on at the moment, and we hope to conclude at the end of July, with September being, we're going to be doing some training with our councillors on community leadership and ward leadership. In terms of all the sets of work that we've identified. So that was a major trot through. Apologies, because there's a lot of data and all of it is now getting outdated because it's up March to May. And when the census data comes out, I'll be updating it and then making it available to everybody. Thank you. I'm going to pause there. Thank you.
Thanks, Celia, for an in-depth presentation. I think Rakesh, you've got your hand up first.
Yeah. I just wanted to say, Celia, thank you ever so much for doing that. You've actually supported a lot of the things I said much earlier on, and yes. It's good to, but the only thing I wanted to just to highlight was that you've missed out one significant group which has also been impacted by the COVID-19, and that's the LGBTQ plus yes. community. And I'm not sure whether, you know, I know houses are very positive, but you didn't mention it in this presentation.
No, it's because my brief was just disability and BAME, but we are doing work on LGBT as well as women. And the data set's also highlighting issues facing women, business entrepreneurs, etc., etc. But the brief today was just the two groups. That's why I've just focused in on that.
Okay, no problem.
And it's also about data, and some of these groups are not. We don't have granular data around LGBT or sexual orientation. We don't collect it at that kind of level. Not as a council. I mean, in terms of deprivation, unemployment, mental health, etc. But we are aware of it from qualitative data sets. Thank you.
Thank you, Celia.
Lisa.
Hello, thank you. Hello, Celia. I just wanted to ask if there is a task force being set up to tackle inequalities with regards to physical activity, because it's these groups that you've mentioned, the disability and also the Black ethnic minority groups that have been obviously the most affected by COVID. I've been on a number of conferences regarding like social prescribing and Sports England, which says these are the people who have been the most marginalised. And I don't think the message is getting across with Hounslow, or it may, but I just don't know about it. I'm a swimming coach and lived in the borough for 42 years, so really know what's going on. And I'm just at the end of my tether, to be honest, because we can make local sporting organisations and physical activity groups can help here majorly.
Lisa, thank you, Lisa. Lisa, are you representing an organisation?
Yeah, I'm head coach of London Borough of Hounslow Swimming Club.
Right. Would you like to join our Disability Recovery Partnership? Because one of the themes we have is health, and responses we are looking at is sports and activities, and we are wanting to we're wanting the co-lead to it to be somebody somebody's involved in activities such as leisure, whether it's swimming or all the other activities, etc. So we it's at the very early stage. We've only had one meeting, and we've identified an action plan in which we've identified this as a priority.
Cool.
So Lisa, if you join us, I'll ask, can I ask if it's possible for people who are in the group, if you're willing to have Ian share your details with me, then I can add you to our groups, the different meetings that I kind of lead, which will then allow you to have a kind of co-design, co-power, co-delivery type of role. And we very welcome every contribution that people in this group can make for us. Thank you.
Thank you. I do know this is happening, but it's just not being trickled down to the other people that are the gatekeepers that hold, that make the final decisions, and they're just trying to twist words and play on words and trying to suggest things that are not right. It's just a mess, and I can just see that the whole thing is just not going to work. And does this include obviously people that can't afford to be active and to get involved in things like swimming, for instance? This is my passion, this is what I want to address, particularly for swimming, because it's a life skill. We're a river borough,
So are you part of the council, or are you independent of the council?
No, we're independent of the council.
Okay, fine.
But I emailed you last night actually, because I just need to fill you in of like what is actually happening, because I come to these meetings every single Friday and hear fantastic initiatives, that's what's being done. And then I go to a certain meeting of people who actually hold the power, as it were, to allow us to engage, and it's like, oh no, we don't really mean that. And it's like, and do you think it means this? And I'm thinking, no, I'm very clear about what everything means. I'm very clear of what should be doing here, So as you can tell, I'm just getting a little bit frustrated.
Well, you can ring me offline and we can have a chat, because I don't really want to because the difficulty is understanding organizational boundaries. So I need to understand your organization and the council's role, and whether or not we have leverage, and to then brief you if we don't have leverage, who can you go to get some sort of direction, etc. So ring me offline. You've got my email address there, and then I'll reply with my telephone details as well. Thank you.
I emailed you last night. Thank you.
Okay, thank you, Lisa.
Okay, if people put their contact details in the chat, I'll circulate the chat to people afterwards. Roger?
Yeah, I just want to say to Celia, I'll be in touch.
Thank you. Thank you, Roger. Thank you. But you're coming to our next meeting, I hope, because we've also got funding, we got people who do funding up there, including Ian. You know, we're inviting, we're trying to create a bit of a theme to support the more fragile organisations and to give advice to the other groups as well.
Yeah, I probably will, but I do attend other fundraising organisations.
Yeah. Okay,
and
so
stuff.
you'll be alert.
You know, I was
yeah,
on
great.
Action Funding yesterday, which was very interesting.
Great.
So yeah.
Thank you. Thank you. Okay.
I think Shanji had your hand up next. Shanji.
I think you're on mute, Shanji.
Sorry,
I
because
think
I was out, I muted myself. Yes, I would be interested to join in as a Sunshine Counselor as well, because we deliver a lot of activities for elderly disabled people as well, with also with the mental health. And you know,
yes.
we deliver like a yoga classes. We have allotment clubs for elderly disabled. We would like to join in your
Perfect. Thank you. Yes. Shanji, would you be able to, are you in a position to email me so that I can then pass your details to staff so that they can make sure that you're included in every invite?
I can send my email in the chat now.
Thank you. So I'll ask Ian to give me a kind of list of the people who want to be included in the Disability Recovery Partnership or the BAME or the BAME Consortium. Thank you.
If you could put in your, whoever's interested, if you could put in your name details in the chat, and it'd be easier for us to circulate that or pass that information on to Celia. So your contact details and your interest in the group. Thank you.
Thank you.
I think, Mikesh, you have your hand up again?
Yeah, I just wanted to, this not being cynical, Celia, but do you really think that our counsellors are going to actually listen to you? Because we used to have counsellors who had disabilities. You now can count even less after the last set of elections, and the voice of disabled individuals is getting slimmer and slimmer. So and I from experience have known that many of them just laugh when they talk about some of the disability issues in private rather than in public. So I'm very cynical about you trying to educate them about understanding some of the issues around disability.
Yeah. So in response to that, first of all, I think it's a great loss that we lost you because you've been a voice for particularly my area of work. You've been there on the Disability Community Forum, sensory disability, etc. So I miss having you in our organisational structures. But having said that, I can tell you now that for the first time since the pandemic, we've had an extraordinary commitment from quite a lot of counsellors in all of my Tackling Inequality group. I've not ever had that level of meetings with counsellors in my 18 years at the council. For the first time since the pandemic, we've had weekly meetings with the counsellors. The cabinet members, something like 20 counsellors have turned up for these meetings. We are producing a handbook, which they have then asked that it go to every counsellor, that it goes to every area forum, that everybody is engaged with the Tackling Inequality data set, and that there is a leadership that we're asking of our counsellors. So that is being led by the deputy leader. So I'm very hopeful that there is a change. There's a wind of change in the borough, but also a fog. And last night, and just before I came on, there was a different report on at cabinet, and members who just had meetings with me had gone into that meeting and said, we want to strengthen equality response on this. We want to see what the relationship to the Tackling Inequality work is. So I'm hopeful that members are beginning to, apply what they're realizing far more than in the past. And also, I think it's also about how much more evidence that's on the table that's helping them. So it's not just lots of anecdotal information, but it is very live to their wards. And I feel that with that level of data at ward level, they're beginning to see that their responsibility is to change that, turn that around. And I can't say it's a level playing field for everybody, for every equality group in terms of LGBTQ and all the rest, but we're making a start. And whether it's Hanworth, where there's a white working class majority, or whether it's Cranford, where there is Black and Asian minority majority, the councillors have finally really got a grip on asking about SIL, that's the levy money, the Section 106 money, and asking about what is the investments that's going on in each of our wards. So I see a wind of change, and I can only say that I'm hopeful, more hopeful than I ever have been in the last 18 years about the kind of grappling of some of the issues, because it isn't easy tackling inequality, especially when it's structural or when it's systemic. It's not about the one person that members might meet at the constituency meeting, or who might come along to the surgery or whatever. It's much bigger, and this is looking at the whole ward. So I think this is the first time they've been presented with this kind of data sets. So I'm hopeful. I hope, Mukesh, that we are both on the same thing. So both of us are kind of trying to make change happen along with all the people that are in this group. And I think each of our voice counts to make the borough a better place for those who are most vulnerable. Thanks, Mukesh.
Omar.
Hi, Celia. My name is Omar.
Yeah, hi, Omar.
I just wanted to say, myself, I'm disabled, and I know what disabled people actually practically go through. So I was hoping you can, I've added my contact details there. And
thank you.
I was hoping you can add me. And I also represent the Somali community, which is, there's people with disability. I don't think even the council, I don't think they're aware of it. So I wanted to brief you more about it. So I've given you my details there, and I've also sent to you directly. So hopefully you can add me, and we can continue from there.
I wouldn't say hopefully. You are definitely in the group, okay? So don't say hopefully, because we value your contribution. Your voices will make a difference. I want it to make a difference. So do please join us for that collective effort to change, because we don't want to be in this situation. If this pandemic is going to carry on with different variances mutating, then we've got to get our solutions and our recovery sorted. And I am bringing councillor officers, Omar, who are working on employment, who are working on skills, asking them to relook at our offer, our adult education, to relook at our offer about how disability accessible is it, etc. And they're being asked to respond, and they're asked to come to these meetings to explain, so that they can learn more about how good those services are, etc. So we are trying to change. So thank you, Omar, for your
I
offer.
appreciate it, but especially with the COVID, even if you didn't get the COVID, as you said before, the lasting impact is people with disability who had limited mobility, like me, and who are indoors for a year. And to be honest with you, with the vaccine being not over to them and staying inside, mental issues and stuff like that. So practically, I know what they went through. So the thing is, I was happy about it. You have already addressed what we went through. Practically, you have said everything. So now taking the action and try to help these people is the main cause that we will work on it.
Yes, thank you. Thank you. So the disability group is called Disability Recovery Partnership. So please join me and add power to my voice. Thank you.
We will do. We'll work.
Thank you, Omar.
Thank you so much. Appreciate it.
Thank you.
Any more questions for Celia? Homer?
Yeah. Hi, this is Uma from ELACE. We work for the Black minority ethnicity, helping them with employment, training, education, and the new project is mental health sessions. So in which we are planning historical parks, visiting historical parks, walking groups, and in future we are also thinking about making a group of the women for swimming sessions, because it might help them.
Yes.
Not might, I think it will help them after a long pandemic, So it is the requirement of the time. After having a long pandemic, everyone wants to have a bit of relaxation. So
yes,
yeah.
thank you.
Thank you.
Thank you. Yeah, your organization works with us on the BAME consortium, but it also works with us on digital literacy. You've attended every meeting, so I'm very grateful for that, and helping us to respond to inequalities as it affects your particular community as well as working collectively with the other groups. What I wanted to say is you're welcome to join the Disability One, because Omar has just highlighted that there is this kind of gap. But I think the key thing is that charity sector is very small, and it's not funded very well. So we all have to bear in mind that they can't necessarily straddle all the equality characteristics always. But some of it is about learning, some of it is about capacity. So I think the key is that we work together to keep things open, so that we can actually offer the support. Yeah, Ile, just want to let you know that please do join the disability if you've got capacity. Otherwise, I'll keep you briefed. Thank you.
Thank you. Okay, sure.
Okay. Any other questions? I'm just aware we're going to try and fit Roger in his presentation next.
Thank you.
Okay, yeah, and if you let me know in the chat you're interested, I'll send your details to Celia. Thanks, Celia.
Thank you very much, Ian, for hosting for us. Thank you.
Roger, I think you're doing the next presentation.
Yeah, have I got plenty of time? Or do you want me to claw back?
I think we can always invite people back. So if you haven't got enough time this time, we can
as much as you want, Roger, I'm sure.
Yeah, and Roger, I'm happy to speak a little bit less, because I've already given quite a bit of feedback on things, so you can take some of my time.
Okay, can everybody see the screen, or have I not shared it properly?
You're not sharing it, no.
Oh dear. This is one of the things about being old and disabled. You have to learn these things.
Let me share it for you, Roger.
Can you share it for me?
Yeah.
Thank you.
Sorry about that.
Oh, yay! Can we
Sorry
see it
about
now? Is it there? Is it there?
Yep.
Yep, you got it.
Sorry, yeah. Go ahead. Sorry about my emails then.
Okay. Now, well, I'm a trustee of the Borough Respiratory Support Group. We've got we have got roughly 60 members, which is across from people with respiratory conditions and other conditions, and their carers. Quite a mixed bag of people, really. If we can go on to the next slide, that'd be better. Thank you. Can we? No, we can't.
Yeah. Yes. Sorry.
This is the one, really. All of our members, we didn't know what the impact of the lockdown was going to be. So where were we on day one? Totally and absolutely lost. And I suspect that probably other groups were very, very similar in that respect. Can we go on to the next slide? This is really the thing. People got letters saying they were clinically extremely vulnerable. Well, some of our members didn't even understand what that meant. So they didn't know what to do. And then you got the question of everybody got it. And the big question is that when you've got couples that both got the letter, so they're both the patient, the clinically extremely vulnerable, and they're also the carer. And this became a real problem And we managed to solve a lot of it. And I'll go on a bit next on the next slide about what we did. I think it's the next one. Yeah, these were the common questions that everybody gave us. How can I get some food? How can I exercise? And how can I get some medications? We managed to get all this information across to them. We managed to explain to them about the community hub and that they could supply them with food. We did get feedback from the people that used it. One particular feedback, which was quite comical in a way, was, yes, thank you very much for my food back, but what do I do with 6 Swedes? I live on my own and I don't like Swede. So we kind of said, okay, well, look, leave it with us. We'll try and find somebody to come and pick the food up and maybe redistribute it to somebody else, which we managed to do eventually, but it took a little bit of trial and error to get it. We go on to the next one. Panic. That was the big thing that everybody thought about. How am I going to do this? How am I going to live on my own? And hopefully someone will tell me how I'm going to do it. So yes, we followed all the government guidelines. We got all the emails that came out every day. We disseminated it down into what we tried to do is easy read, which was not always simple to do. But when you've got people that are not the best educated, it can be a bit of a struggle, and people were ringing us up and saying, what does this mean? What does that mean? Can I do this? Can I do that? Yeah, we managed to sort it eventually. Can we move on? This is what I'm saying about phone. I think there's some bits underneath which are maybe not. Okay. Yeah, the phone was never stopped ringing for about the first month. And then it eased up quite a lot. People got used to being on their own. And eventually we managed to get people to be more digitally aware. It took a lot of work. Tell them over the phone, do this, do that, do this, do that, and eventually you'll get some information. But it works for some people, for others it didn't. We tried to get people to connect with the virtual world that we set up for them all. Some did, some don't. I don't want this, I don't like this, I want to see people, is what we got quite a lot of. Can we move on? And these are some of the real phrases that we got. I'm bored. I'm not surprised. I'm fed up. I miss my family. I miss my friends. Fed up just talking to my partner. Isn't daytime TV boring was quite a common thing. I'm eating too much. Yeah, well, I suspect that probably it is. There was one little story. We got an 83-year-old woman who lives on her own. She's a 24/7 oxygen user. And she said, what am I going to do for food? I can't cook. I always go out and eat every day. I don't like my food. We said, well, do you want us to order some food for delivery to you? And we can get you some meals? Have you got a microwave? No, I haven't. Would you like us to buy you a microwave? And we went through all these scenarios, individual scenarios for people around. We did set up a WhatsApp group, and that helped a lot but only for a very small number of people that we've got that wanted to use it or could use it. One of our members managed to decide that he had a long-term wish to do some painting, and he managed it somehow, and he populated that around the group, and it's really very, very good painting. Had a chap who said, okay, look, I used to do a bit of singing, so therefore I will do a recording and sing a song every day on the WhatsApp channel to keep people amused. So it's like our own simple radio. He may have done one, he may do two, and it worked. It kept people amused. And well, actually, I thought it was pretty awful, but there you go. It wasn't my type of music. Now, virtual meetings, we started off and we got a reasonable number, but as time has gone on, the numbers are dwindling. Can we move on? And I'm going to take a little bit of a break now because I do suffer with respiratory problems and I can't talk for very long. So I thought I'd just put a couple of stories up and you can read them for yourself. We move on, Naoka. Well, hopefully people have got through that one. Okay. I think hopefully these two stories kind of represent what the group suffered across all of us. Over to anybody who wants to have a question, I suppose. Oh, no questions. Lovely.
Okay.
I think it was a very touching presentation, Roger. Thank you for that.
Roger, I put my hand up. I actually don't need to do my presentation now because you've covered 90% of what I was going to talk about how we feel and what's happening. So I'll only cover a small amount, if that's okay, Ian, about what I've done, rather than, because all the empathy which has come out of what Roger's just said is essentially what many of us who have disabilities have gone through, and the scary element of where in 1 week you get a message saying this person's died, that person's died, and by the way, that family's lost 3. Those issues were the things that really kind of really made life difficult, because you realize that you weren't able to see them, and the last time you saw them was, before the pandemic. So I think all the things you've highlighted have been really brilliant, and I'll cover a couple of those issues when I come to do my presentation.
Yeah,
thank you, Roger. I think you did a wonderful.
Yeah, we did actually lose one member to COVID, and which was very, very sad because he was only in his early 60s. And he hadn't been out of the house for 9 months, so nobody knows how he managed to get COVID. He did, and he passed away.
Roger, is it possible for me to ask a question? It's Celia here.
Celia, of course, madam.
Hi, Roger, you were talking about how people learned about how to connect digitally. Can you say a little bit about, were they people who didn't have any digital skills before the pandemic and then had to learn how to go on Zoom, had to learn how to go on Teams? And then when you did the WhatsApp and sharing pictures, can you say a little bit more so that I have a better grasp of, is it just your group, people with respiratory illness, or was it a wider set of disabled group that you were supporting?
we do support a wider group, but mainly all our members are respiratory. What we've actually done digitally was to actually talk to people over the phone. Those who have got smartphones, it was a little bit easier because they were used to some things. But we managed to talk them through, and so they could connect up to other things that they wanted to connect up to. You know, we've taught them how to connect up to the NHS app, which takes a long time to do. But there are people who did not have any digital skills whatsoever. We did manage to get a small grant from the National Lottery, and that enabled us to buy some laptops, and we bought some MiFi for people, and we distributed that out to them so they could at least go on, and we taught them how to search for things on the internet to get information, we even suggested, look, hold on, instead of watching daytime TV, why don't you go onto YouTube? If you've got a particular music interest, you can tune in and do a search on YouTube and maybe watch a concert on YouTube. We also joined a thing called What's on Stage. And you got lots of streaming things that people could watch, and we circulated that around. Some people, you know, got a couple of people very, very interested in the ballet, and there were a couple of ballets that were streamed, so people could actually sit and watch that and have a nice gin and tonic and safety at home. So yeah, we did lots of different things, but we tried to cater it for what people wanted rather than blanket.
Yeah. So Roger, were people, how did you install the software and the setup and all that? Do you have a specialist in your organization?
No, we don't. It was trial and error, Celia. I did it.
Okay, fine. No, that's really helpful to know, because obviously I want to do, I am interested in digital inclusion, and I'm on that group. So I'm interested in knowing how you as an organization made the difference for your members. And whether there's some learning we can use to, you know, share across with other organizations working with people with disabilities who are not digitally connected or digitally have devices, etc. So it's interesting how you went about doing that for your community. So I just thought there might be some things that we can learn from it. Thank you.
Well, yeah, and you know, myself and we've now got a PA, which is very useful because she's a lot younger than us. We've been attending Jane's digital sessions, which has given us an insight of what additional things we might be able to do. And I've already mentioned the NHS app. You know, we know that the vaccine certificates are on the NHS app. So trying to get people to actually on that in case they do want to go overseas where there's restrictions and you've got to prove you've had the vaccination is going to be a little bit of a challenge. But once we're able to meet face to face, it's going to become a lot easier, one hopes.
Yeah. Thank you, Roger. Thank you very
much. Mukesh?
Yeah, Celia, I'm in my little presentation, I'll talk you through what I've been doing with community groups and disability groups. So
thank you, Mukesh. Yeah, thank you.
Any more questions for Roger? Okay, otherwise we can go over to Mukesh and you can do your
okay. Thank you for that, Ian. And Roger's done an awful lot of my presentation for me, so can I thank him for that. What I'm going to just focus on is a little bit more on the digital side and also the community aspect. So I think I've only got about 10 minutes. I'll try and do the things. Many of you know that I'm part of Disability Network Hounslow, and that's a group which I think, Celia, I'm hoping that's included in your both of your groups about getting people out and about, and also the BAME community as well, because there are many members in there, and we're very active in representing people.
Yeah.
When March the 23rd happened, even prior to that, I was already using web conference tools anyway because of the work I do in Rotary, because I needed to talk to fellow Rotarians around the world when we were doing humanitarian projects. So for me, it wasn't too much of an issue. And for 20 years, I was using BT Conference when I was working. So one of the things which I had to explain to people was the need that if their organizations needed to continue, was that we needed to carry on communicating. And using the telephone was great, but conference calls were a bit more challenged because not everybody understood what that meant. So the first thing I actually did was to look at the lowest common denominator in terms of the groups I've worked with. And I wrote an idiot's guide to Zoom, and also explained how you installed it, and so on. And in the beginning, it may have meant having a telephone in one hand and my laptop in the other, and using my fingers to try and talk them through how to install Zoom. Some of them I also installed Microsoft Teams because they said they needed that or something else. So I actually have 8 different web tools on my laptop, and I have to be familiar with all 8 of them because people from different organizations use different things. But the two which I use the most are Zoom and Microsoft Teams, and the other one was Google Meeting, which was free as well. But as I had a professional license, I was able to do a lot more than the average person. And so we started with small groups, showing them in 1, 2, 3, or 4, getting them together, getting their confidence up, and then started scheduling meetings. Initially, it was once a week. And when we talk about having it once a week, the idea behind that was to actually demonstrate support and also have some pastoral care to make sure their well-being. So many of the things which Roger's talked about, they were being asked of us, and how could we help them? And the folks who were a bit more physically able to were supporting the ones who were a little bit less able to. So it was really important that they understood that. The other thing which I did with Rotary is that we actually created a document on where you could get food. It sounds daft, but we actually had a document which had all the food banks, all the community cafes, how you can contact them. We even had the local authority contact details as well for Hounslow. And then we gave that to many of the community groups we interacted with, who could then send that out. But we also printed a lot off so that places like the Open Kitchen, St. Paul's Community Church, they could actually hand those out to people who were needing help. And many of them don't have access to the internet. So having a physical piece of paper was really important. The other key thing was that as we migrated one community group, somebody else heard about it. I may not have had a link with them, but I soon did, because they said, can you come along and help us also to migrate, so that we go online and we keep in touch with our members. And would you believe it, at the end of the day, I had migrated over half a dozen community groups. Some of them were disabilities, some were related to helping in the community in terms of supporting areas of deprivation. And it was really important that we did that. But with the actual community groups, because of my finance background, one of the key things I needed to do was to help those organizations continue to operate. You may think, now, what's all this about? But you know that there are so many people who are passionate in doing charity work, but they all think from the heart, but they don't think from the head. And what I do is I do both. And I had to be a realist and actually say to them, right, what's your monthly outgoings? And explain to them that, hold on, if you carry on as you are, you'll run out of money by October. What are you going to do? Are you going to just the last one out switches the light off, or are you going to plan for some contingency? So we put some reverse project plans in, also to make sure that we had employees. We considered how could we furlough them. Some of those people who were furloughed actually secretly were volunteers as well, so they continue to help us discreetly, but not as employees. So when you add all of that digitization, making community groups being able to talk to each other, the pastoral care, which is just making sure that Fred is okay, or we had one person who was blind and also another one who was hard of hearing. In terms of profound hearing loss, their carers weren't able to come to see them anymore, and food was an issue. So what we did was that we worked with organizations like the Open Kitchen, and the Open Kitchen then delivered a meal every day, 7 days a week, to these individuals. And the meal was enough for them to have not just lunch, but also dinner as well. Any other items, we tried to help them through voluntary organizations. Medication, we helped them to get link up with the pharmacies, because many of the pharmacies were actually doing deliveries either themselves or through volunteers. So if you think about where we were in March and we didn't know what to do, to where we are now, many of those organizations are still here today. They're still providing a service, but in a slightly different way. The way I look at it is that what I was doing 10 or 20 years ago online, in the past 14, 15 months, we have done a complete change of being able to help people with disabilities. Some of them still have, phones which are not smartphones, but it still means that the ones of us who can do things, we still call them, right? Or we send them a text message saying, "Are you okay?" And even a single text message made a huge difference that someone was looking out for them. We also started helping them to install panic buttons. This is one of the things you have around your neck, that if you fall down or you need assistance because of an injury or whatever, they were able to touch that and get some form of assistance. But even today, many of them are absolutely paranoid about going out. And I think one of the biggest challenges is going to be this mental health thing, where people will need much more help in being able to come out of their self-imposed prisons because they feel unsafe outside. And I think one of the aspects of which the government or the local health authority has to do is increase the mental health budget, but also be able to do some practical exercises of getting small groups created to help people. Ian, I think I've said too much now, but I'm open to questions. But I think what Roger has said and what I have said complemented each other. But the other person I wanted to thank was the fact that your own organization was able to change as well. And you've had yourself doing the funding opportunities. You've had Jane doing some of the community digital work. And many of us in this group are part of that group. We have been going out and supporting others, and I think it's been so important that we've actually been able to work collectively. No sacred cows, ask as many stupid questions, because there were no stupid questions, because all of us respected each other in being able to do things. I'm going to stop there and thank you, Ian, thank Jane, Nika, for doing so much work to support us more than anybody else. I'll stay quiet now. Roger's got his hand on.
I just want to echo Mukesh's thoughts. Without Ian and particularly without Jane, we couldn't have done anything for our members. It's you telling us and educating us, which has really helped. So thanks for that.
Yeah, and I think we all educated ourselves, because we've been on sessions and Roger said something, Lisa said something, I've said something, and then we've gone away and we've tried it and it worked. I'm still not comfortable with Microsoft Teams as I should be, but this week Jane did a wonderful session, and she saw the practical problems which we encounter, unlike doing Zoom. But I had an idiot's guide created, which I did, and I passed that out. So if anybody wants an idiot's guide, I'm more than happy to give that to them. All right, thank you.
Yeah, thanks, Mukesh. Jane, do you want to say something?
Yes, I did actually just want to make a quick comment. Mukesh failed to mention that actually he is our leading digital champion. The difference he has made to organizations throughout COVID has been phenomenal. And I really do appreciate your input into each of the sessions that you've attended. And I was just wondering, one question that I have, Mukesh, I knew you some years ago when you were a counsellor, and respected your role and the participation you showed in everything that you could, because you were perhaps one of the most vocal and most engaged counsellors at the time that I was in the council. I was wondering, you know, having now worked in the council and now with this last year working outside the council, it seems to me that in some way you've had more impact working outside of the council than actually being a councillor itself. Is that your feeling as well?
Yeah, I've spent my life working in the charity and the third sector.
Yeah.
And when I retired, I made it a point to continue doing that much more. But when I was asked to consider being a counsellor and I became one, one thing I did find was that my hands were tied. And I wasn't able to say things or do things because I could face the wrath of the whip's office. So I had that issue, and the terrible thing was, I was in the whip's office, so I had to control myself.
Yeah.
But as I've come out of it, I've been able to go back to what I was doing. I can be I can take a supportive position, and some of the work which I've done, if I had been a counsellor, somebody would have turned around and said, "You're not meant to be doing that." And I think that was the thing which many people were upset about, because I was so enthusiastic about supporting my community, which I've lived in all my working life. Yeah. So,
well, thank you, Mukesh.
I think I go along with that.
Yeah, I do think that just looking at what you've done both in the council and now in the charity sector, and my being involved with the charity sector now as well, I think that what happens in the charity sector has a more direct impact, and we're able to, within the charity sector, looking at things like what Elays are doing and Roger and Lisa, there is such a real connection with our local community within the local charity and community sector, that there's a power in it and such good work being done that needs to be celebrated. I just want to do a little plug this to everyone. Next week is Charity Week. Not Charity Week, Volunteer Week.
Volunteer Week, that's right.
So remember, look out for some events, because it really is an opportunity to celebrate all the volunteers.
Yeah, as I said, for myself, for Volunteer Week, our Rotary International organization in these islands is celebrating in a big way. I just missed out on not meeting Ross Kent, but hey, who's Ross Kent, you know, unless you're an EastEnders fan. But I think it is important, like this year, you know, and I'm going to give a little, I'm going to blow my own trumpet. I got recognized as a through the British Citizens Award volunteer system, and there are only 27 people in this country who got recognized, and I was one of them.
Well done.
And that, but would you believe it? Did London Borough of Hounslow want to celebrate one of their own getting that? The answer is no.
Yeah.
Okay. The only people who celebrated it were the community groups, who said thank you for all the work I've done in all the years. But I was just overwhelmed by being recognised for all the work I've done.
Thank you, Mukesh. And we do appreciate what you do. Honestly, I think every time you turn up at a meeting, we're happy to see you. Can I just say, just on the volunteer week thing, anybody who has got an event next week, please remember to put it onto the EHCVS website, because you can put it onto our calendar, and we'd love to help you promote it and just showcase what is actually happening in the local area. Sorry, Ian, I'm taking up too much time.
Roger's got help.
Sorry.
Yeah, it's a
Ian,
question for you, Ian, really. We got Small Charities Week coming up in June. What are you doing? Are you doing anything for the Small Charities Week?
Yes, I'll answer that, Roger. We're running a series of events all through the Charities Week in June, and we will be putting up information shortly. But in terms of the Volunteers Week, which we're going to be running this week, if you have any events coming up, send them to us, and we'd love to publish it and promote it for you. So Charities Week is coming up, and yes, we can't forget that.
Okay, any other points you want to make? I know we've overrun a bit. We had quite a few speakers this week. I'm doing a top tips on funding applications this afternoon at 2:30, so I'll send the link to people if they want to sign up for that, if they're not already signed up. I'm not quite sure what's the topic next week.
Sorry, Ian, what you said? What are you doing at 2 o'clock today?
I'm just doing a little session on like tips on improving applications, funding applications.
Oh, right, okay.
2:30. So
Thank you. I hope you send me one as well. Thank you.
Yeah.
Thank you.
The event is already on Eventbrite, but we'll have to email Ian if you need the link immediately.
And yeah, I'm not sure what the topic is next week. Nyoka, do you remember what the topic is next week? We'll send details anyway, so. And obviously, anything
no, I'm always unprepared. Sorry about that. Next week, we'll be talking about homelessness and well-being, and we have a couple of speakers who would be with us. John Kurt, he's from the Ministry of, let me just get that for you. He's from the Ministry of Housing, Communities and Local Government. And we have Hamza Faisal, who would be talking about diabetes again as an inclusion. And we also have a spot European Settlement Scheme, which is coming to really a close deadline. So the support they're going to be offering. Do join us next week to hear more. Thank you.
Okay, yeah, thanks for attending this session, and hope to see you next week. And obviously I'll send the presentations and the slides afterwards. Thanks.
Sorry, can I just put a plug in for the 7th? We've got a cybersecurity expert in coming to do some digital support work for everyone, and you'd be welcome to join us. I'll put the link in the chat.
Yeah, and I'll circulate the chat to people as well. Thanks. Bye.
Thank you. Bye.
Thank you. Bye.
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 Bye. Thank you, everybody, for joining. Bye-bye.
Thank you. Bye.
Jen.
Bye, Sharonjeet.
Jen, are you coming to a